WCCO.
We are breaking back into programming to hear from Governor Tim Walz about new technology meant to track the spread of COVID-19 in Minnesota.
Many of them, so I'll try and remember to reiterate and repeat the question and then answer it. This last week's been tough, Minnesota. There's no other way to put it. Our numbers are unrelenting in our hospitalizations. You've seen records set in terms of cases, hospitalizations, ICUs, and then unfortunately deaths. Our hospitals and our first responders are doing everything they possibly can. And as we said last week, there's reasons to be optimistic. There's reasons to be optimistic over the horizon with a vaccine. There's reasons to be optimistic now that we have new therapeutics that we're able to use. But there's also reasons to be optimistic because the data shows if we change our behaviors and take some of the mitigation efforts, there's a cascading effect that keeps people from being infected, which keeps people out of the hospital, which keeps people out of ICU, which saves lives. That is simply the math, and it's what we asked last week. I want to be very cognizant of what got asked, especially of our small businesses and hospitality industry, our gyms, our fitness facilities, was pretty dramatic. Asking folks who have already been through probably the most difficult 8 months of any business cycle since the Great Depression, asking them at a time of holidays where in many cases that's where most of the money is made up, is a very, very difficult thing. And because of that, we've been asking and pushing that both the federal government, state government need to do everything we can to help mitigate that. So I'm pleased to say that we worked over the entire weekend with our legislative partners. I want to give a special thank you to House Majority Leader Winkler, who worked extensively on this, and to my team by Wei Win leading, putting together a package of relief for small businesses. It's absolutely critical that we get something quickly to these businesses, we get something that makes a material difference to them and bridges the gap until the federal government can do what they need to do, make a substantial impact on the economics and the well-being of Americans by passing, whether it's the HEROES Act or a modified version of the HEROES Act. As I've said many, many times, all 50 governors are unified around this. We know that this needs to happen, but the state of Minnesota is going to take some of these moves. And what I'd like to say is the package that we're going to be putting out tomorrow, that we are prepared, along with cooperation with the legislature, I'm prepared to call them back into special session and pass this package immediately. The sooner the better, the relief will be there. Some of the things that we're able to do is sales tax forgiveness for businesses that sell food and beverages, waive state regulatory fees, exploring direct relief for individual workers, one-time food grants to businesses to provide food to healthcare workers, homeless shelters, and long-term care facilities. This is the best that Minnesota can do, and it makes financial sense. Create a state tax credit for food donations in the hospitality industry, and elimination of the COVID-19 Minnesota Fund expiration date. These are just a few of the things as part of this package, working in conjunction with legislative leaders and, more importantly, working in conjunction with the business community on their suggestions to put this package forward. So I want to just speak to those businesses. We hear you. We thank you for making a public health move. By closing your doors, you're protecting people. By closing your doors, you're ensuring that we can get our economy back better than we have before. And so for that, as I've said time and time again, you should not have to bear the brunt of the financial impact alone. All Minnesotans share in that. So I think this package will be a great way to do that. Again, I would reiterate to our federal partners, to the outgoing administration and to the incoming Biden administration, please work together. Please find a compromise in there. Please, if you have to, move a package now with the idea that you will come back and move one later, because COVID is not going to end at the end of the month. We are in an unrelenting spike. And again, it forces us to make the moves we made. With that being said, we've also got another announcement today, another tool in our toolbox to slow the spread of COVID. What we know is the most dangerous part of this disease is the asymptomatic spread, especially amongst very mobile and social 18 to 35-year-olds. This is not out of malice. It's not out of not caring. It's simply, in many cases, out of ignorance of not knowing that you've been exposed or you have it. You're not sick. You don't feel it. You're trying to take precautions. And all of a sudden, you have it and you spread it to someone else who spread it either into a long-term care facility, into a school, or someone ends up in the hospital. And so one of the best ways is for people to know if they've been exposed to COVID-19 can they, and this is what we've ensured can happen, get a test in a rapid manner to get a rapid result that they can then be informed to take all of the proper precautions, whether it's quarantining or notifying others that they have been infected, to be able to break the chain of spread. So what we're doing today is, with the help of a nonprofit PathCheck Foundation, who helped develop an app called COVID Aware Minnesota. Some of you heard me talk about this a little while back. It's being used by about 20 states now, and what this does is, and I have done it, it is painless, it is free, and it is secure that you download a dashboard. I have exposure detection on, and what will happen is, if I go take a test, and the health department we will then get a code that shows me that I've had it, I'll put it in, and it will then notify everyone who was around me within a 6 feet radius for 15 minutes or more that they've been exposed. Randomly, there is no data tracking, there is no data collected, there's no data sent to the Minnesota Department of Health, nor to Google, to Apple, to anyone. It is simply a random key that's generated that Commissioner Tomes will explain the specifics behind it, that guarantee privacy, but give you another tool to know. So you were on that patio and you were eating and you don't think there's any reason to be concerned, you could get a notification. Now, I want to be clear to Minnesotans. This is an opt-in alternative. You don't have to put the code in your phone, and you don't have to notify others that are around you. I would strongly encourage, if not beg you, please do so. It's random. People deserve to know if they've been exposed to COVID-19, and then they have a responsibility to make the proper move then. Get yourself tested. If you're positive, quarantine, and then we can notify others. This is not contact tracing. This is not in and of itself going to stop the spread. It's another valuable tool that helps us do that. And I'd just like to say, the work that's being done by nonprofits, the work that's being done by businesses, the work that's being done inside state government to ensure that folks have the capacity to be able to understand what's happening to them is critically important. So I would like to, have Commissioner Tomes from Minnesota Department of Information Technology explain a little more about this. We're joined by Chris Erzman, the infectious disease experts. This is that interchange between those two, of where we're able to use technology to fight against what we know now is a relatively predictable virus in terms of how it's spreading from one another. It's just how difficult it is because of the asymptomatic spread to let people know. And I would like to make note to Minnesotans, you've seen commissioners up here, you see Commissioner Malcolm a lot, and you see Commissioner Grove and others, and Director Erzman's been up here. Commissioner Tomes runs all the state's IT services, and I think during a pandemic, a pretty amazing thing happened last week. We closed a chapter on our vehicle services with MinLars and launched MinDrive, and for some of you familiar with this, that was the biggest story for about 3 years running. Commissioner Tomes did that, while we simultaneously, over the last year, moved and migrated an entire lottery system while it was live to another system that had never been done in the country. We've updated systems ranging from workman's comp to our high schools and Minnesota Department of Education computers. All of those things are being done in a new creative manner, working with the Blue Ribbon Commission on Technology, working together with public, private, nonprofit, universities, and Commissioner Tomes' expertise to bring an energy together to make sure that Minnesota's IT systems, Minnesota's upgrades from legacy systems works. And I would also note we just went through the most secure and safest election in American history. And here in Minnesota, along with the work of the Secretary of State's office and Secretary Simon, Commissioner Tomes was one of the people for the last 2 years that was working to ensure that happened. So with that, I would turn it over to Minnesota Minute Commissioner Tomes to talk about COVID Aware.
Thank you, Governor, and good afternoon, Minnesotans. Again, my name is Tarek Tomes, and I'm the Commissioner of Minnesota IT Services and the Chief Information Officer for the state of Minnesota. Slowing the spread of COVID-19 is a community effort. It requires the commitment of all Minnesotans to do our best to keep each other safe. Notifying friends, neighbors, or people we may not know of a potential exposure to COVID-19 is essential to slowing the spread of this virus. Doing that is often very difficult. Today, Minnesotans have a new tool, COVID Aware MN, which is a data privacy-centered COVID exposure notification app. that will help us do just that. This adds another important tool for communities that allows us to bring our mobile phones to the fight against COVID-19. The more people that use it, the better it works. But before we get into how this mobile app works, I want to make a few things perfectly clear, building on comments that the governor just made. The Apple-Google partnership to create this exposure notification capability was created with data privacy at its foundation. The app itself is completely 100% opt-in. We can decide to adopt the app. We can decide to share a warning with others. We can also decide to share how big of an opportunity it is for others to use this app. The app itself does not track your location or use GPS in any way. It doesn't transfer any information to the state or to anyone else related to location. It does not use your identity or share your identity with others, including with Google or with Apple or with the state of Minnesota. If you install the app, at no point in time does it ask you for any identifying information. It never accesses personal information on your phone, such as your contact information, and it doesn't require you to provide any additional information. So let's talk a little bit about how this app works. The app is completely opt-in. It's a free download available in the Google or Apple mobile app stores. When people opt into the app, their phones generate a random number that changes frequently and periodically to protect the identity of people using the application. When two phones are within 6 feet for 15 minutes, the phones exchange these numbers via Bluetooth. When someone tests positive, they have the choice, and it's really important to underscore that they have the choice of using the app to warn others. Health authorities provide a code that is entered into the app. People that have been in close contact within the infectious period will then receive a notification that they may have had a potential exposure. When you receive this notification, at no point in time does it tell you who triggered the notification. It doesn't tell you where the exposure potentially occurred, and it actually doesn't even tell you the precise time of the exposure. It just gives a broad time range within the last 3 days, within the last 4 to 6 days. And again, available for download for free from the Google and Apple Play Store. At the core of this was a groundbreaking partnership between Google and Apple. As you can imagine, Google and Apple have not partnered on many things. But in the onset of this pandemic, Google and Apple partnered with the knowledge that a data privacy-centric framework that would allow people to bring their phones to this fight against COVID-19 was essential. We partnered together with the Department of Health, amazing technologists at Minnesota IT Services, and our nonprofit partner, the PathCheck Foundation, who has developed and launching this app in other jurisdictions as well to create this wonderful opportunity, really a groundbreaking set of partnerships. But that partnership has to extend beyond us. That partnership has to extend into communities that look into the potential that this application can provide in fighting COVID-19 and adopt. Businesses with an ability to warn employees potentially, schools, colleges, universities, where the adoption of mobile phone technology is very rapid, with an ability to notify people that we don't know that should be notified, religious spaces. I was at my barber not too long ago and had a conversation with my barber about the potential of using an app like this. And it was really clear as we exchanged a conversation that if I can trust my barber to cut my hair, he probably would be an excellent person to vet and validate that this is a useful tool for Minnesotans. It is that community collaboration that will be essential for this. I want to encourage all Minnesotans, our visitors, and anyone that spends time in the state to download COVID Aware MN and to tell your communities to do the same. The premise here is simple, yet impactful. If communities are willing to adopt the app, use it to report positive test results, and follow health recommendations when notified of an exposure, this app can help us return to many of the activities we miss so much and save lives. I am a father of very active kids, ones who miss playing basketball, who miss going to school, and everything else that this pandemic has taken away from us. Along with other measures such as wearing masks, social distancing, and testing, if we decide to adopt this app as communities, it will help us protect each other and put us on a path forward. Every little bit that we can do to put an end to this virus is so important. The exposure notification technology and COVID Aware MN provides our state with a powerful opportunity to take action and does so in a way that protects your privacy and information through the whole process. Please visit covidawaremn.com to learn more. I'd like to transition now to Chris Erzman, who will give you an update on the current situation in Minnesota and will also provide some information on what happens if you receive an exposure notification warning. Thank you.
Thank you, Commissioner Tomes. I too have downloaded the app on my phone, and I just want to say that if I can do it, you for sure can do it. And if you don't believe me, just talk to my kids and they'll tell you that that's a miracle. So anyhow, I'd like to give you an update on what we're seeing at the global level in terms of COVID-19. Our global total as of this morning was 58.7 million cases, up 500,000 cases from yesterday, and 1.39 million deaths worldwide, an increase of 7,354 deaths. In the United States, we're at 12.2 million cases and over 256,000 deaths. Minnesota added another 6,353 cases today for a new total of 276,500 cases. In addition, we added 6,265 cases Saturday and 7,219 cases on Sunday, so another weekend with alarming numbers. At our current pace, we will eclipse 300,000 cases this week, right around Thanksgiving. And we could see another 100,000 cases in 15 days. We hope that some of the recent dial-back measures will help delay these milestones. Sadly, today's update includes another 24 deaths. When you add that to the total of 90 deaths reported over the weekend, we have a new total of 3,205 COVID-19 deaths in Minnesota since the start of the pandemic. 8 of these deaths occurred in residents of long-term care facilities. There were 9 deaths in the metro area, 6 in central counties, 5 in the southwest, 3 in the northeast, and 1 in west central Minnesota. And our total includes 6 people in their 90s, 7 in their 80s, 5 in their 70s, 3 in their 60s, and 3 in their 50s. There have been a total of 15,106 patients hospitalized and 3,480 had to receive intensive care. And right now, we have 1,778 people currently in Minnesota hospitals with COVID-19. And of those, 364 are in an intensive care. Our new case total of 6,353 cases comes on a volume of 57,015 lab tests. And our 7-day testing positivity rate is at 15.2%. That's up from 13.7 last week, but it is 0.2 of a point lower than we had seen in the last 2 days. And I just want to share some public health context for today's news about the COVID Aware Minnesota app. We're really pleased to have this tool in our toolbox as part of our response effort because it will supplement our contact tracing efforts. Typically, we have to rely on a person remembering who they may have been in contact with and the places that they visited while they were infectious. And oftentimes that's difficult, and sometimes people have been in a situation in which they can't remember or they don't know the people that may have been in close proximity to them. So with this exposure app, Minnesotans can anonymously inform people they don't know but may have been in close contact with about a potential exposure. The more people use the app, as Commissioner Tomes said, the more people can be notified that they may have been exposed. if all the people who may have been exposed stay home and avoid contact with other people, they can't spread the disease. And so this is really important as we work to slow down the spread of COVID in Minnesota and to get ourselves back on track. Additionally, as the governor said, some people don't ever feel sick and they can still spread disease to others. So this will assist them in being able to make notifications. And just to explain what would happen if you did happen to have this app on your phone and then test positive. The state or local public health officials would contact you directly to confirm your positive test report. And if you've downloaded and enabled this app on your phone, then we can provide you with a test result verification code. So the code is not tied to your identity, and as you've heard, no one will know who you are, but it does allow you to make a notification through your app to people who may have been exposed to you. And this can only happen after we validated the test results and provided the verification code. So there's no opportunity for, someone thinking that this might be a practical joke. It has to go through our process. We have to verify the test results, and we do provide the code. So there are safety checks in the process. And if you happen to receive, so you've got this on your phone now, and you receive a notification that you've been exposed, the notification includes links to our health department site, and it includes some guidance from us on what you should do. So it will say you've been in contact with someone who is tested positive for COVID, and you need to stay home for 14 days. That's the quarantine period. We encourage you to get tested. Even if you have a negative test result, however, you still need to stay in quarantine. And the reason for that, as we've talked about, is that the incubation period is 14 days. And so if you happen to test negative on day 5, that means you still have the rest of the incubation period to potentially become positive and infectious. But as you heard, the app will give you a range of time when you may have been exposed to help you with your decision making on quarantine. If you have symptoms, we want you to get tested for COVID, and you can also talk to your healthcare provider if you want more information. If you don't have symptoms and you got that notification, again, we want you to stay home for 14 days, stay out of circulation so that you aren't a potential source of infection and transmission to other people. And the app will also give you some guidance about when you should be tested. Usually we say about 5 to 7 days after exposure, just because that's a more likely time that someone would have become positive, and so the test will be meaningful. But the app will give you a date range when the exposure likely happened, and you can also talk to your healthcare provider to get more advice on when to get tested. But we're really excited about what this could mean, particularly in this time when we're seeing so much transmission. This app will really help us enhance our outreach efforts in terms of our public health response. Thank you, and I'll turn it back to the governor.
Thank you, Director Erzman. Minnesotans, as I said, it's been a challenging week, and we're in the most difficult time of this pandemic. We're also in the most hopeful time of this pandemic. We have tools, both therapeutics for treatment. We have vaccines on the horizon. The news from AstraZeneca Oxford today gives us another one. Soon you'll be hearing news from Johnson & Johnson and others that opportunity is there. Those are all things coupled with this app that right now, if we dig down, we do the things that make a difference: mask up, socially distance, follow the mitigation rules, download this app. If you need to, get tested, quarantine, and let's break the spread of this as we move forward. I spent extensive time this morning with our team on briefing on vaccine rollout. I will leave this briefing and be on with Secretary Azars from Health and Human Services, who will be updating the nation's governors on where we're at on vaccine rollout and development. Just so folks know what's different this time about it is they will doing simultaneous work on this as well as prep for manufacturing. In normal times, we would be going through all this, and once everything was done and they were approved, then they would start figuring out the manufacturing process. It has been being done simultaneously. No corners will be cut. Safety will be a top priority. Minnesota will verify that, but the opportunity is really great. But here's what we can't do. We can't let our guard down. We can't put people at risk when we know there's things we can do to make a difference. So I would hope right now, if you're listening or you're thinking about it and you've gone on to the Apple or the Google Play Store and you've downloaded that, it is literally less than 30 seconds to get yourself up and running. And here's the thing. If everything's done right, you will never have to use this, hopefully. You will never be notified, and you will never have to notify anybody else. But if it does happen, this is your opportunity to be a good citizen and pass it on. Again, I want to just tell you the conversations, and I spent a lot of time in the United States Congress on this issue of privacy in a technology-driven world, that is a top priority along with the healthcare benefits. You heard Commissioner Tomes talk about this. I can assure you that we have done, and outside groups and privacy groups have run the traps on this thing. Your identity is protected, your location is protected, your anonymity is protected. But here's the thing. It also can protect your health. So with that, I'll take some questions from our pooled reporters. Maybe I'll let Commissioner Tomes, and I'll take responsibility on this. Commissioner Tomes was very early adapter on a lot of this. We've been very aware of this technology early on. I think one of my concerns was making sure that we had run the traps on the security and the privacy piece of this. And once again, I think getting a little bit of field testing on this and getting it out there amongst people really matters, because if people choose to believe, or if they get caught in, a conspiracy theory black hole on the internet, they don't do the adaption. So it was trying to find that proper balance. Commissioner, you may talk, because we've had this conversation for a month.
Thank you. I certainly don't think it's too little, too late. This pandemic has certainly proven to be incredibly unpredictable, and this is another tool made available to Minnesota communities that communities can use alongside with masking, social distancing, and other health measures. I think we still have a long ways to go, and every tool that allows us to resume activity in our communities, whether it's in social spaces or economic spaces, really is important. It's a tool that can help protect employees in settings, a tool that can help protect families in settings when reaching out to people that may need to be warned isn't possible because you simply don't know who they are. And so I don't think it's too little, too late, as the governor mentioned. We, from the onset of this pandemic, have really scoured the globe related to opportunities that technology can play to assist. How can we use innovative technology to help everyone? And from the onset, certainly the data privacy aspect was unbelievably important to us, and we really spent a lot of time watching the rollout, looking at the rollout, while we were continuing to work in these spaces to make sure that we rolled out an app that could really brought broad consideration to the data privacy concerns.
Who created this? So was it the nonprofit? Did the state create the app? Who's doing the work in the development?
It's a great question. It was really an amazing partnership. So Google and Apple partnered on the exposure notification framework that is broadly in use across the globe now, and it has at its core data privacy. We then embarked on a partnership together with the Path Check Foundation, physicians from the Mayo Clinic, amazing epidemiologists from the Department of Health, to kind of co-create what an application like this could look like. Our epidemiologists at the Department of Health actually provided feedback to Google as it relates to infectious periods that altered how that exposure notification framework worked. The actual app development work was done by the Path Check Foundation, and they're launching a similar app in other jurisdictions as well. It's a nonprofit organization.
People have to get a diagnosis test, then they can contact the Department of Health to get the code. I mean, would the state be tracking everybody who's got COVID with their names? And how does this work in other states? Have people been willing to do this?
Yeah, so I'll start with your first question, and that is,